probably heard the term eating disorder before, but what exactly does it mean? An eating disorder is when someone has a very hard time eating the right amount of food or consumes food in a way that is not healthy for their body. This can mean eating too much or too little, or worrying too much about their body and food. Sometimes, people with eating disorders might feel very sad, scared, or upset about food, and it can be hard for them to feel better without help. Let's talk about binge eating disorder. It's more than just eating a little too much sometimes or grabbing extra snacks when you're feeling down. Binge eating disorder is when someone feels like they can't stop eating a lot of food, even when they're not hungry. They might eat quickly or eat a lot of food in a short time. During a binge, they may feel calmer, but then after, they feel totally out of control, embarrassed, or guilty. The whole thing can turn into a cycle that feels impossible to break. In Canada, the prevalence of binge eating disorder is around 1.8% in teens and 2 to 3% of the general population. This means that many young people are impacted by BED, and it's important to recognize the signs early so that help and support can be sought. And here's the thing, it's not just about the food itself. It's tied to emotions, stress, and even how we feel about ourselves. We all overeat sometimes, maybe during holidays, at a party, when you're bored, or after a tough day. That's normal. But binge eating disorder, like other eating disorders, is a pattern that happens regularly and starts affecting you in many ways. How you think and feel, how you socialize with friends and family, and even your health. It becomes a problem, not just an occasional thing. Biologically, some people are just more vulnerable to eating disorders. Your brain chemistry or genetics can play a big role in how you react to stress and food. But biology is just one part of it. Life experiences play a big role in why someone might develop an eating disorder, like binge eating disorder. And then there's the environment. Family or friends might not have healthy habits around food, which can make it harder to learn how to eat in a balanced way. Or if you grow up in a place where the focus is all on looks and body image, especially with the pressure of social media, it can make things even harder. The constant comparisons and pressure can really take a toll. Everyone's situation is different, but it's important to remember that if someone has an eating disorder like binge eating disorder, it's not their fault and they can get help to feel better. Anyone, regardless of age, gender, or background, can develop binge eating disorder, but teens between the ages of 13 and 17 are especially vulnerable. Why? Because being a teen means dealing with huge changes, emotionally, physically, and socially. There's pressure to look a certain way or fit in, especially with social media constantly in the picture. Eating disorders tend to affect girls more often, but other genders can struggle too. Individuals who have experienced trauma, such as bullying, abuse, or a significant loss, may be more susceptible to developing eating disorders as a way to cope with emotional pain. People with a family history of eating disorders are also at higher risk, as genetic factors can play a significant role in the development of BED. These combined influences make it even more important to recognize the signs early and seek help when needed. Eating disorders don't always show up in obvious ways, but there are signs you can watch for. For binge eating disorder, the signs might include eating a lot of food very fast in one sitting, eating alone or in secret or hiding food, eating when not hungry, feeling out of control with food, feeling guilty or ashamed after eating, talking a lot about weight, food, or their body, avoiding certain foods or meals, food not lasting as long as expected, feeling irritable and or down. These could all be signs that you or someone you know is struggling. It's tough, but if you notice things like this in yourself or a friend, it might be time to talk about it. If left untreated, eating disorders can have serious consequences on both your physical and mental health. Binge eating disorder can lead to nutritional deficiencies because you may not be eating the foods that your body needs to stay healthy. It puts you at a higher risk for conditions like type 2 diabetes, heart disease, and high blood pressure. It can even affect sleep. And the food behaviors that were used to soothe emotional stress in the beginning actually lead to more severe mental health issues, anxiety, depression, or even thoughts of self-harm or suicide. At the very least, it becomes harder to connect with others, causing strained relationships. The longer an eating disorder goes untreated, the harder it can be to heal, so it's really important to reach out for help as soon as possible. Asking a healthcare professional for help with binge eating disorder is an important and brave step towards better health. They will respect your privacy and keep everything you share confidential, except if there's a concern for your safety. This means you can speak openly and honestly without worrying about your personal information being shared. A doctor, therapist, or counselor will listen to your concerns without judgment and work with you to find a treatment plan that works for you. In your initial assessment, they may ask about your eating habits, how often you feel out of control around food, your emotions, stress level, and overall mental health. They may also ask about any feelings of guilt, shame, or distress you experience during or after eating. If needed, they might recommend lab tests to check for physical effects of binge eating, like nutritional deficiencies. If they determine that you have binge eating disorder, they may formally diagnose it based on your symptoms and how it affects your daily life. From there, they will guide you towards effective treatment options to help you manage and overcome the disorder. Specialists understand that it can be really hard to open up about eating issues. Having a private conversation with a doctor or a counselor is a good first step. A healthcare professional's job is to try and support you to help you feel better. One of the most common and effective treatment for BED is cognitive behavioral therapy, CBT. CBT helps you understand how your thoughts and feelings affect your eating behaviors. It helps people work through negative thoughts and replace them with healthier ways to cope. Therapy is usually the most important part of the healing process. Sometimes medication can be part of the treatment to help with anxiety or depression. You may also see a dietitian to help understand how to care for your body with food. Eating disorders don't just affect how you eat, they affect everything. Teens with eating disorders may struggle with school, relationships, and even just feeling like themselves. It can make it hard to focus, hang out with friends, or enjoy things they used to love. But remember, if you reach out for help, things can get better. Horizon's Child and Youth Mental Health and Addiction Services support young people dealing with these challenges. Teams include counselors, psychologists, social workers, and other professionals who can guide you through any emotional, mental health, or substance use concerns. If you're worried about yourself or a friend, don't wait. Talk to someone you trust, whether it's a parent, a school counselor, teacher, doctor, or even a close friend. Starting that conversation can be hard, but it's the first step in getting the support you need. Try not to skip meals, which makes binge eating disorder worse. Your body needs to eat regular meals and snacks. A healthcare provider like a doctor or counselor can help by understanding what's happening and how it's affecting your health, recommending treatment options, helping you find ways to manage emotions that might be tied to binge eating. No matter what you're going through, you don't have to face it alone. Whether you're dealing with an eating disorder or worried about a friend, reaching out for help is the first step to feeling better. Your health, both mental and physical, matters, and you deserve the support to get back on track.